So the big thing that we talked about last time was the fact that when we're treating, you're really not treating, you're not changing things as far as like breaking up adhesions and breaking up scar tissue. We've never talked about stuff like that in the past. Pretty much what we're doing is we're kind of initiating a process with manual therapy. So we're using, directed inputs to create the process of change. And this is not going to happen just by using our fingers. We know that. We know that it takes a lot more force to change connective tissue, including fascia. But we also talked about the fact that using our manual inputs, and we kind of referred back to Langevin and some of the work that she did, and how using small forces, using acupuncture needles, you're able to activate fibroblasts, which are the basic, cells that create these changes in this tissue. So we're using manual inputs to kind of initiate changes, create an activation of some of the cellular components of that tissue, and then we're using on top of that more global forces, using stuff like some of the FRC concepts that we use in the system.
Okay, so then just to review, so what we were saying and what we have said, of course, I think the argument that we're breaking up scar tissue, breaking up adhesions, we've discussed this at length before. Although that's a popular straw man kind of concept that people might utilize to maybe denounce the usefulness of soft tissue therapy. As we've said before, that's never been our concern. We've never believed that to be what we were trying to do, nor what was actually being done from a physiological standpoint. So from a physiological standpoint, at least the way that we understand it, the way that we teach it, the way that we interpret the literature, is that mechanotransduction, or the propagation of force-based information or input over longer periods of time, lead to change in tissue structure, organization, architecture. Whereby, as we often discuss, we don't feel that the soft tissue application itself, or in and of itself, is enough to create long-lasting change. Just looking at the first principles literature on connective tissue, it's very easy, or one can come to the conclusion very quickly, that connective tissue, versus a lot of the other tissues in the body, is slowly adapting. It takes time under tension. It takes repetition of input, etc. So what we were discussing was the idea that the soft tissue application is maybe creating a window of opportunity by inputting direction-specific tension information into the system, which then we posit needs to be backed up by further information or directional information that we how do we say this? That we input utilizing specific contraction techniques, isometric techniques, stretching in combination with isometric techniques over time. So that it's, the idea of changing connective tissue architecture is a process of loading, whereby some of the loading can come from a therapist's fingers in order to increase the specificity of the directional loads, but then it has to be backed up with exercise.